So, welcome to the third annual, well, I guess it's the only year, discussion overseas about how we can help manage the COVID relief in Bangladesh. And I don't know if any of you saw the videos that we had previously, but we were brainstorming in the first one, just gathering around like what information any of us knows about COVID, what we can do. And the second one, while we brainstormed a lot of it was discussing like how to move forward and progress now that we had like a couple ideas down. And from here on out, it would just be focusing on like getting the group started and getting the movement started. So like just a little summary of what we've been doing, and I do this for almost every meeting. What we started was a fundraiser, and the fundraiser was on GoFundMe. We raised 2,000 and right now I think it's $2,036, and we're looking to increase the funds to possibly $5,000 or $10,000. So what we're looking for is one group of people, like, and we would organize mainly like have everyone who wants to be a part of the fundraising team go on WhatsApp on a separate group chat, and then you guys would take charge of that, and I would like give you guys the access to the GoFundMe, etc. Another group was for media specifically, so just getting information out to people because there's not a lot of like sources that we can reach out of. And there was another comment that I got from one of our viewers and the people on the Facebook page that I'm live streaming this to, that a lot of our posts are in Bangla, and some of the members, they can't read it, or they're not Bangladeshi, but they still want to help with the cause. And so maybe we can get a group going that can help translate like the videos that are up there, help close caption them, or translate like the pictures that we see so that people can actually oh, we lost him. Coming back. Zoom calls. Hi. Oh, the audio is connecting. Okay.
Sorry, my bad. I'm just coming on for a second. Yeah, I think I logged back in. Okay, sorry, keep going.
You're good to go. We can see you now.
Okay, perfect. I logged in with my phone, so that should be done.
Okay. Where was I? I think it was for talking about media. So translation would, and getting like the information that that is fresh and new out to the people. It'd be a nice hub to locate all of the coronavirus information in regards to the Bangladeshi population. And another would be PR / outreach. So the main goal of a PR outreach group would be to connect new people, especially like us, like diaspora kids who are living outside of Bangladesh. So Canada, like Anan, America, like us, UK, Australia. And it would be like adding more people onto the Facebook group, just like expanding it, what we can do, adding more people who would be interested in doing Zoom meetings so we can expand our work. And that is kind of a wrap of like a summary of what we've established in the past 2 meetings. And I'm gonna give it up to everyone to do introductions. So who would like to go first? Ladies first?
Okay.
Okay.
Okay. My name's Mahia. I'm a sophomore in college. I found out about this group through Pia, and I'm really excited to kind of, work with you guys, and yeah.
Okay.
I guess I can go next. Hi, my name is Munzir. I go by Munzir. I'm currently living in Canada. I work as a clinical trials assistant, and I'm also very excited to see what this group is about, and find out how I can contribute in every way possible.
Is my mic muted?
No.
It isn't? Ah, yeah, okay. This is bleeping red. I'm Salman Sharar Beg. Um, Bia told me to come, so I said sure. And I like to think I know a little bit about COVID-19 from my father. Yes, that
Would you like
works.
to elaborate on that?
I mean, my dad has COVID-19 patients. He's spoken at Bangladesh, like medical associations with the Dhaka medical professors. And so he's one of the people that actually discusses and brings out the issues with the coronavirus in Bangladesh.
Mm-hmm. So, I don't know if you guys have seen all the posters a lot, but actually, Sharar's, well, Sadwan's dad, Dr. Beg, posted this video and he had an interview about how this novel treatment that was specifically used for kidney patients was helping people who had coronavirus. And these are like things that if we're more connected, we can help get like trials tested out in bigger numbers. People can like discuss and share these ideas. And if we have it all in one hub, it's just going to be an easier way to connect all of the ideas. And so ideally one location, but ooh, my internet is unstable. Sorry, guys. There's like a huge storm going over us. But yeah, outside of that, I was wondering if any of you guys had any ideas that you think could help us, you know, organize a relief.
When you say
I'm
organizing,
sorry, go ahead.
no, it's okay, Mahia, you
No,
can
no,
go.
no, you go.
Okay, so I just wanted to ask, when you say organizing a relief, you mean like so efforts that we can do to help out patients and people in Bangladesh who are suffering from COVID, right?
Exactly.
Okay, and were you thinking along the so do you have any people on the ground in Bangladesh who like?
Yes. So this where I'm working with Eminence for Bangladesh, which is an NGO, and they're located in Dhaka. So there is like a physical like force there that can do things. It wouldn't have to be like, oh, we're just getting this over there and we don't know what's going to happen over once
Okay.
all the products are there.
Okay. Okay.
Yeah. So like one of you go first.
I was just gonna ask Mahia to go, but yeah, it's okay. Go on. Sorry.
Mahia?
No, dear, you were saying something. Go ahead.
No. I insist.
I mean, so right now we have a fundraiser going on, and I think idea-wise, I don't really have anything, but I do think if I can join like the media group, I would love to like brainstorm. I can like make flyers for you guys, you know, if you want to make them like a bit like visually appealing, I can help you guys do that. And I can get the word out. I can, you know, share the group and everything. And yeah, I'm looking forward to that.
That would be amazing if we can get that started. One other thing that we've been trying to get, but it's been a little bit difficult considering like how the masks prices have been going up and down. There is a severe lack of PPE, so personal protective equipment in Bangladesh. And this is limiting the essential workers a lot. So doctors and nurses, when they're unable to obtain these items, they don't feel safe to work in the environment that they're in. And because of that, the patients are also suffering and they're not getting treated as fast. And last time I brought up how my grandfather had bed sores because people are afraid of going near him because they thought, hey, he might have COVID because he has pneumonia, but he didn't. Thank God. But it's just like a thing that outside of just like destigmatizing the disease, we need to figure out how we can get masks over there. And outside of just like the masks, I don't know what other protective gear we can figure out. I know that locally, there's this one high school teacher that I knew. He has a 3D printer. He's printing out the face shields. And he's been printing out face shields for just like local hospitals, but recently I've seen that he started printing them out for the Navajo tribes out who really need the PPE as well. So if you guys know anyone who has like a 3D printer who wants to get involved, maybe start like a project about this, that would be something great.
Okay.
Yeah.
So, in terms of supplying PPE to the people in Bangladesh, um, uh, so are there factories or companies that are producing PPE currently, like in Bangladesh? Because what I was thinking along the lines, like,
I don't know if there are. I don't know if there's enough. Like from what I'm getting from information from people is that there's just not enough production. And in like the last chat that we had, this one guy, he's Bengali Indian, and he joined in and was saying that there's this factory in India who is producing it, and he wanted to help figure out if we can get like a shipping line from them into Dhaka.
okay.
But I just don't really know about like the production of PPE in Bangladesh at this point, like what the rate is. That would be like something that a knowledge group or like a research type of group would be able to find out, like people who have sources.
Okay.
Yeah.
Really quickly,
Sorry, go on.
if you'll come in. So when you say PPE masks, right? I've never really heard of the term. Are these synonymous with the N95 masks?
So the N95 mask, K95, surgical masks, the surgical, the plastic head covering. At this point, like any of them would do because there's just not enough from what I've heard. And I know that N95 is like the ideal mask shape, but I know that K95 is also something that people are using.
So I guess what is basically what I'm basically thinking of is that why is there a lack of supply? Is it because of funds? Because if it's funds, then I guess the next step we would have to do is, quite frankly, fundraise within our communities, within other places in Canada, North America, and I guess for you guys in the US, fundraise for money to supply into these companies in Bangladesh who are already producing these PPE, to increase their production. That could be one thing we would do. And, from our end, being here, we could take care of the fundraising part, where the people who are in the ground in Bangladesh would be responsible for getting sort of a bit of an R&D going, find out which companies are making them, what their problem is, why isn't there enough supply? Like, are they lacking the raw materials, or are they lacking the funding itself?
Yeah, that would probably be ideal. I know that it's just entirely that it's funds. I know that they're lacking PPE, just like places to get them from as well, like in terms of production. But I don't really know who like people could contact to get that information. Like I don't have a lot of people my age in Bangladesh that I still keep in contact with. And that would be something like maybe the outreach group that we're trying to create can handle, because this could be something very educational for all of us, especially like the kids who don't live in Bangladesh anymore, but we do have this connection. If we can get connected to the community over there for the people like our age, it would be a really nice way that we can like understand each other and like help this cause,
Okay.
But yeah, do any of you have any outside of Mahia, do you guys know any fundraisers that are going on currently?
Yes. My friend, actually a group of my friends I think they started their own organization. It's called Bachara, and they are not only doing their own fundraiser and doing their own supply, they're also acting sort of like a source group for all other fundraisers, like different people who are doing different things in Bangladesh. So I know in their website, when I go to the Bachara website, they have links to different GoFundMe pages where this one person is supplying food to the day laborers. This other person is collecting money to buy gas cylinders, oxygen cylinders for hospitals.
Mm-hmm.
And so, yeah, that's a good side that I know is trying to get funds for these kind of activities in Bangladesh.
Yeah, that would be fantastic. Do you think that maybe I can like send over the GoFundMe that we have to them?
Yes, I think that would be a very good idea. I was actually thinking of reaching out to you and letting you know about this other group. But yeah, for sure, after we hop off of this call, I can definitely connect you with the person who I know is part of it.
Okay. So, I know that they're mainly connecting like different groups together, right?
Yeah,
Or
they seem to be doing that. They seem to be connecting different groups together because the idea is we're all trying to help the situation, right? So rather than competing with each other, they sort of acted just as a space for all of us for all these different groups to get together or different causes to get together. And like, people have different options from there basically of what cause they want to contribute towards.
that's awesome. Yeah, we can definitely, that would be something that would be smart if we connect the fundraising link that we have over there, and we can help fundraise. I was gonna ask you guys, is there a particular set of groups that I was talking to that you guys would personally be interested in joining? I know that Mahia said she'd be interested in the media group. Is there anything that Sadman or you would be interested in?
For
Um,
me, I would say anything that really needs people in. If I mean, I'm being rather vague right now, mainly because when you say that there are things that we can do, right?
Mm-hmm.
The only thing that comes to mind is media, really. What else can we do? I think is a better way to phrase it.
Well, outside of media, the PR group would be something that would be integral to getting this like going, because they would be the ones who would get a lot of the people connected, like the new members who joined. You would be managing like helping organize the main chat. So once everyone does these chats, I add you guys all onto a main WhatsApp chat, and so everyone is there in like one group outside of the smaller groups that like the media group, the PR group, etc. So a PR group would be managing a lot of like the connections between like you guys and us. And if we wanted to like invite other people, other community leaders, community members, for example, like I know that there's a lot of community leaders in South Florida, and if you guys could reach out on like our behalf and be like, hey, I'm from this group, we're doing this type of fundraising, or we're trying to collect face masks, how can you contribute to this, would you like to donate, etc. That would be like something that you can do as a representative. And if you aren't for that, then a knowledge group would be something that we really, really need, because I know that the Bengali literacy level for most of us kids overseas isn't what people expect for us to have. And a lot of the media and news that we are getting, if I'm reading it, I can read it and I'll just understand like a little bit, like I'll get a generic idea. But if I want the details, I'll be like, Google Translate, let's see what this actually says. And even then, it's not like completely accurate. So that would be something that would be really helpful, because we have like multiple videos that are posted onto this page. Like right below, there was this one doctor, I'll send you guys the link afterwards, that posted about how he made an announcement of when the WHO said only infected people have to wear masks. Then he was like, no, everyone should wear the mask, whether you're infected or not. And then the WHO retroactively was like, hey, actually, we found out regardless of whether you're a positive case or not, wear a mask. And he brought up how he's been commenting on this for a while, but the video is entirely in Bangla. And there are other people who want to help. A lot of my friends who are in this group, they're not even Bengali, and they really, really want to do their part to help out in any way they can. But because a lot of the resources in the videos are in a language they don't understand, closed captioning would really help make it more accessible to people. Also, I'm thinking if like there's a viewer who's deaf, then that's something that could really help, you know?
That sounds something definitely like my cup of tea. I can help with the translations and the closed captioning.
That sound okay, that's great.
All right, then I can do PR.
PR?
Yeah.
Okay, sounds good. Okay, so we made a little bit of progress. So, Anand, I actually have someone who also, he's in Canada. His name is Arin Goswami, and I don't know if you've heard of him. Maybe you have. I don't know what part, because Canada's huge, so, you know.
Very,
very huge. But the Bengali community, like whenever you mention a name, like people will be like, "Oh, I know this person." Like even down here, so I don't know how like tightly knit it is.
No, it is tightly knit, but like within the sorry. Go on.
Yeah, of course. So I was thinking of maybe connecting him with you because he's also he has a lot of resources in terms of this one doctor.
Sorry, yeah, you're cutting out really badly. Would you be able to repeat that, please?
To speak on our behalf, and he knew this one actress. She's not. Can you guys hear me now? Here, yes, no.
A little bit.
Give me one moment. Can you guys hear me now?
Yes, yeah.
Better.
Okay. Yeah, it's really, really bad, like outside, so.
So the last thing I heard was you saying he knows some actress here in Toronto, or I misheard?
So he actually knows a Bengali actress, but she's Bengali Indian.
Mm-hmm.
However, she does have like 2 million followers or something on Instagram, and he said that he was going to try to connect with her so that like if we did have, for example, a fundraiser or some type of particular cause or even infographics about Corona, if she did share it, you would get a lot of like traffic on it, you know? And so it would be something that I feel like would really help, but I don't know if any of us know how to contact someone famous in Bangladesh, because that would be even more helpful because, you know, they're in the location of the country. PR guy, what do you think?
I can probably ask my dad, because before he became a doctor, he was a reporter for Bangladesh. And so he knows a lot of the actual celebrities over there, Bengali and Indian celebrities. He used to like travel for them with cricket and stuff like that. So I can ask him, because I know one time he was able to pull his connections, and when the Bangladesh cricket team came down here in Florida, we're able to meet Mustafiz and Sakib Al Hassan. So I'll just ask him about that. That's what he says.
That would be great. That would really be awesome. Okay, so what have we got? We have fundraising that we need to continue on.
I have a question. Sorry to cut you off. So far what you've told me is that we need knowledge, PR, and media. But what I feel like you refrain from saying, or I'm not sure if this is really important, would be the actual spread of information or the threat of the virus in the regular populace, right? So when we talk about trying to spread the word, right, with PR and stuff like that, fundraising, how are we going to actually take the fundraising money and actually apply it to the society? I still don't understand the logistics.
Okay. So I'm taking the money that is over here and I'm wire transferring it to Eminence directly, the NGO that's over there, so that they can get it to the Bangladeshi Americans, the Bangladeshi Americans, the Bangladeshis over there. And what I feel like would be really helpful is if we can list like what we would like for them to do with the money. Like I know for a fact, one of the things that they would like to do is get basic medications for chronic illnesses for patients. For example, like diabetes and hypertension patients, even though coronavirus is spreading in Bangladesh, a lot of the problems with like the general population is they're unable to get the medication they need because they don't have jobs right now. They're unable to go to work. They can't make an income, and because of that, the chronic illnesses that they have are getting exacerbated because they're unable to treat it. And a lot of the hospitals right now are swamped with overflow of patients because of corona, and they're also afraid to go to the doctors because of the stigma that's going around. And so one of their main goals is to get medication out to the people who need it the most. But also another point that they've listed is getting funds like for food and like general, I guess, water costs to people. So that goes in line with like essentials that people who are unable to reach it. So like in the poverty line and below it, getting that fund out would be really helpful. I want to do something that would like push the government to make some type of policy change, that because if we like as we're foreign Bangladeshis, if we can do something like to pressure them and be like, hey, listen, your people are suffering, if you can get like a fund going or help them have like a rent relief, something to just help the regular people, that would be ideal. But yeah, those are the main two things. And they also want to help get PPE out to essential workers as well as journalists, because the news that Bangladesh is releasing is dependent on how many journalists you have on site, and journalists are not able to get their PPE either. And so without that, they're not able to report at the efficiency that they need, you know? And so then there's like a communication gap between what's going on over there and then what's going on over here.
Then I want to ask this, right? Even if we do all these things, right?
Yes.
The big factor, like the glaring factor that I think is going to be the most annoying, I suppose, would be the stigma for hospitals and doctors, for the common citizenry, right?
Yeah.
So I don't know how regular Bangladeshis, they get their information from, right? Other than from NTV or something like that. So don't you think it's imperative that we actually think about how we can subvert this stigma, I suppose? Because the same thing plagued India when I was writing a research paper on it. I was doing a research paper on COVID-19 for Bangladesh and India collectively, because their process of dealing with the disease were quite similar. The problem is the difference between the two cultures was that Indians were far more likely to actually stay inside than Bangladeshis. I was looking at the stats. So is there any way, so when you say we have reporters, right? Is there any way for us to get in contact with, let's say, like larger Bangladeshi news companies or something like that? Since you are we're part of an NGO.
Yeah.
Is there any way you can try and get them? Because if I can get in contact with them, right, and actually have a discussion, I think as someone who actually does public speaking and I guess you could say a whole lot of talking, I think that we could probably try and coordinate some sort of section where we deal with just talking about the coronavirus, not on the actual cons of it, because that's what I've been seeing. Like my grandfather is watching, like when they speak of the virus, they speak of it as something quite severe, right? And I feel like that's actually contrary to popular belief, I actually think that inhibits regular Bangladeshis from going to the doctors. I think that just further fuels the stigma. So in order to break that, I think they
Yeah.
should, instead of like speaking on the same like problem, saying, "Are you going to die?" or "This many people dies," right? I think they should also add in explaining that going to the doctor is
Yeah.
imperative, right? One of the reasons why Miami instead of like Parkland, right, where I live, is like getting a lot of coronavirus cases is because it's a low socioeconomic area, and the people there don't have access to the proper healthcare, and they're also probably afraid of the doctors.
Yeah. So you raise good points. It would be really good if we moved away from like an entirely fear-based approach to scaring. Can you guys still hear me? Okay.
Yeah.
But yeah, if we like moved off from a fear-based approach, if we approached from somewhere of like rationality and logic, it would be helpful. And there is like a certain amount of fear that I don't think we can get rid of. This is a pandemic. It is something that is dangerous. But to mitigate the fear, we can have like, for example, media can like Mahia can create some like infographic with the help of someone who's a native Bangla speaker with the new information that we have, something accessible, something not too complex, not too many bullet points, simple to the point that you can share. A lot of the information that people are getting are from social media, like WhatsApp, for example, is driving a lot of the infographics that are being shared, especially like with my mom. I'm seeing that she'll get like some type of weird remedy that they're saying, and she'll like relay that information on to me. And so like if we can get statistical like data or something that we see was reported on the news that may have otherwise been like overlooked because it's kind of scary or it's too long and wordy, if we can make it concise and package it up nicely by the media team, and then the PR team can handle sending it out or figuring how to reach people, that can be a great way to reduce stigma, right?
I agree with you with the way you established everything, but the one thing that I don't necessarily agree with is your statement on focusing more on rationale. Because if there's one thing that we know, the reason why this sort of fear-based tactic works, right?
Yeah.
Is because it's emotional. People respond better to emotional pain, right? So if we're able to actually apply something to our culture, right? Because something integral to the Bengali culture is Islam, right? So when we actually like talk about this, right, I find that a lot of people, when I was in Bangladesh, right, responded very well when I'd relate our world like environment to that of an Islamic era, right, of the Ottoman Empire, the Mughals, right. And so I believe,
but
you're saying.
I mean, I know what you're saying, but at the same time, like, not all of Bangladesh is Muslim, There are
I know,
Hindu
but what I'm not
Bangladesh,
saying
like,
is we're not going to
like
we're not going to explicitly say it. I never said really how we're going to actually like present it, right? It's more so just the acceptance of one's past is integral to speaking to an entire community. That's what I find. Like, so when I'm doing a PR campaign here, right? So like for my local representative, right? The thing that we do is that we speak of rationality, yet we also bring some sort of like statement, like some sort of subtle nod to a historical. I suppose, like, how the United States has been historical, like Christian, right? So we would bring in some sort of, even if it's an area which is predominantly of a different religion, like here in Parkland is predominantly Jewish, right? But even just the statement of it, right? Just the acceptance of the environment around us, because when you speak on Islam, right, you speak to an entire cultural history, right? When you speak of Christianity, you speak to an entire cultural history that is based or serves as the foundation of a country, right? So I think when I say religion, I don't want you to think of it as I'm saying that we should just go head on, right? I think there's a subtle nuance to everything when we bring on religion, right? But ultimately, I think when we do
So how
our
would we go head on and be subtle at the same time? That's just like what I'm trying to understand. Because head on,
so
usually means that you're going direct and pretty
yeah,
forceful. And subtlety, you need delicacy. So I'm
yeah,
just trying to
which
like,
is
understand like
yeah. So I'm doing a terrible job of explaining it because I have to
weird.
think about how I'm going to word this. Um, but I'll leave that on the side. I'll speak to you about it later and like further expand upon it. Um,
Okay.
but I want to go back to like the statement of rationality. I think that in order to actually speak to the populace,
Mhm.
right, a populace which is primarily a superstitious society, I suppose, to a certain degree, um, in the South Asian continent altogether, really. Um, I think that instead of us like giving cold hard facts, right?
Mhm.
I think when we give those facts, right, when we say those things, I think we should give it with like some sense of hopefulness, right? Something
Yeah.
for the people to actually look up to.
Hmm.
And I think the best way to do that is always to bring in a person from a local community, right? Which
Hmm.
is like airing this, right? And who's actually fighting through like, COVID-19, and
Yeah.
just have their input on everything that's happening, right? Someone with an optimistic like outlook on everything. And I think that'll serve best. And
Um,
regarding um the local news, right?
You Anna, you wanted to
I didn't
yeah.
hear one sorry.
Oh no, no, it's okay. Basically, just to kind of refocus, like just thinking here. So we're talking about the fact that in Bangladesh, people are not going to doctors because they're scared and because of stigma. That is what we're predominantly talking about, right?
yes,
Yeah.
Okay. So, and correct me if I'm wrong, and I may be wrong,
I
but
think
I
so.
feel, yeah, sorry,
Off a little bit.
you kind of cut out again. Sorry.
Hello?
Hi.
Hello?
Yeah, I can hear you now.
Dang it. Okay. Okay.
It's better now. Yeah. Go on.
Sorry.
Okay.
Oh, whatever you were saying, I just couldn't hear it at all. It froze.
Oh, okay. Where was I last? Where did you hear me last?
About the stigma.
Okay. So I may be wrong,
Is it
but
me?
what I feel like rather than the stigma of going to the doctor for a lot of them, it's the accessibility in itself that's the issue. The fact that they're not able to go to the doctor because healthcare is not free in Bangladesh. You have to pay, like, it's not free. Everyone has to pay out of their pocket for every kind of healthcare, right? And for a
Hmm.
lot of the people, accessibility is the bigger issue. The fact that they have to pay for the doctor when they may not have the money for it, and that also makes sense because a lot of people do not have jobs right now, are not getting paid. So there's that, and also the
Yeah.
fact that some people can't go to the doctors just because, like, I think, sorry, to summarize it, I feel like a big issue here, rather than the stigma of going to the doctor itself, is the fact that they can't go even if they want to, even if they want to, because of
Hmm.
money issues. And money issues is there, and the fact that there may not be enough doctors around, or because Bangladesh is one of the most crowded populations in the world. So the doctor to like patient ratio, I'm not 100% sure of it, but I'm pretty sure they're also coming close to being overwhelmed. So that's also another issue that we have to think about, you know?
Yeah. No,
And
for sure. Go. You go.
okay, so I actually agree with you to a certain extent, but when you say money, right, money issues, the I feel like in Bangladesh, almost I was actually discussing this with my dad when I was writing my paper. I was asking him how is the Bangladesh healthcare system, right, with regards to this pandemic, right? Now I'm not talking about like regular, just with regards to the pandemic. And he told me that it's exactly as you said, like the entire hospital is already swamped. And if you look at it, even without the pandemic, right, even like Dhaka Medical
Hmm.
Hospital, right, the own like top university's hospital, when I went there, it was still swamped with people, like overcrowding the halls and everything,
Mm-hmm, mm-hmm.
right? But I don't think the issue is the actual cost, just because of how everything is subsidized by the government. I think it's because, as you said, I think it's the overcrowding, or rather, there's so many people there, right? The population density, that it just makes it difficult for doctors to actually assist people. And then once people die, right, because of this overcrowding, right, more and more people get afraid, thinking that they'll die if they go inside those areas.
Yeah.
So that's definitely true. And for me, what it's boiling down to, like in terms of what we can help with, is that so step one. So like if you want to address the issue of overcrowdedness, obviously we can't go in and put more doctors in Bangladesh right now. That's not really an option.
Yeah.
So if we think about strategies in terms of how we can reduce people from getting sick, we can, for me personally, based on what I have read about the disease and what I know about the daily lifestyle of Bangladesh, asking people to stay indoors and socially isolate is wouldn't feasibly work, because there are people who who earn like sorry, there's a phrase in Bangladesh, in Bengali, if I'm trying to translate it. Basically, they
Go
earn their
say it in
daily
Bangla. You should say it in Bangla.
din ani din khai, right? Whatever they earn that day, that's what they use to feed themselves for that day, right? So, and so these people can't afford to stay indoors because they physically, like, they will not have the monetary funds. So they have to go out and get food. So in terms of what we can help with, I feel like the biggest thing we could do is to provide food and these kind of food and other basic necessities to these people, so that they don't feel the necessity to go out and work and earn their wages, and thus allowing them to stay indoors and slow down the spread. You know, the idea, basically,
Yeah.
the idea is, unless we have a vaccine, we're looking at an end goal where almost everyone gets infected. That's
Yeah.
one of the worst case scenarios, but that is the reality of it. So how can we slow it down? If everyone is going to get infected, let's slow it down as much as possible, you know, so the hospitals are not overwhelmed. So how do we keep these people indoors? For me, the best way to keep them indoors is to supply them whatever they need, which is why, like food and stuff, for which they would have to go outside. So that's just my two
Yeah.
cents.
I I agree with you, right? I agree with everything you said. But the issue is that if we take that approach, then where are we gonna get the money to actually, let's say, buy the masks for the like actual hospital, or just workers in general, right? Healthcare workers. With what you said, it would just be a great like economic strain on the fundraiser, right?
Couldn't we do
So
both though? Like, because we've already raised $2,000, and if we had another fundraiser that raises another 2,000, then we can have one set of the money go towards the masks, and another set of the money can go towards the food, right?
Yep,
how
for sure.
long will the food last? Or rather, how long will this money support, and how many people will it support?
For me, mathematically speaking, there isn't really an end goal. The longer you can keep it supplied, the better. You know, every
Yeah.
single time, every single day, you're preventing one person or helping one person from going outside, you're stopping them from going outside, is one less person with a probability of getting sick. So unfortunately, there is no end goal to it, because we would need the money to come in as long as the pandemic is out. But as long as we have the money, I feel like we should keep it supplying. And if it runs out, it runs out, which it obviously will. But
Yeah.
that's just, you know, my thing is that every little bit helps, no matter how long, even if it is for one single day, that is still one less person being sick.
Yeah. So if for yeah, those are great points. Like, if we can prevent one person from getting infected, that's one less vector who's going to spread it to 10 more people that they interact with. If you keep them home, they're going to spread it less. And on the long run, you're going to get less of an oversaturation, and you're going to have less congested hospitals. So doctors will be able to treat it better and faster. So the problem with the disease is that most of the people who are carrying it and the positive cases are younger people. And so they may be asymptomatic. And if they do show symptoms, they're not as severe as the elderly patients or the people with like secondary health issues such as diabetes, hypertension, etc., like all those problems. So the chronic illnesses usually build up with age, and those are risk factors that younger patients don't have, and younger patients are the ones who are going out. But when they come back home, they have usually, like, you have your parents who are a little bit older. Sometimes your nana nani or dada dadi are going to also live in your house, and they're older. if they infect them, then that's another patient that the doctors have to watch out for and treat. So like, as much as we can prevent like the population from going out until like one mass of it is like treated, that's the best thing we can do, because I don't know how the virus is currently working, but we have seen cases of reinfection. Like, usually we're assuming like once you get the virus, the end you're immune to it or you can't pass it on. But if are cases of reinfection, then this is just going to keep happening, and older people or people at risk with like immune deficiencies, they're just going to keep getting infected, and people are going to die at unprecedented numbers. So I do agree that one of the main goals will be to just help the people stay inside, because it's true, like if you can't afford like feeding your kids, you're like, oh, I'm going to risk possibly infecting my whole family, versus guaranteed if I don't go out to buy dal right now, no one's going to be able to eat for this entire week,
Basically, yeah, absolutely.
Yeah.
So what I have to say to this, right? If we take this route, right, it's still the issue of what environment will we supply the money to, or what people in what community will we supply this money to, right? That's like just like the first thing, right? That answer can come from anywhere, right? It could be Dhaka, it could be it could be any district. And then the second issue is if we phrase $2,000 again, right? Let's say we raise it again, right? Using the other 2,000 to buy masks, right? And I think with buying masks, right, if we were to buy with $2,000, we can get around like almost 1,000 masks, right? Depending on where you get it from in bulk, right? If I'm right, yeah, I'm right. All right, so and then the 2,000 now that'll be used to help keep these people inside their homes, right? How are we going to decide who gets this money? How are we going to, let's say, I don't know to word this. If, for example, I have a community of 10 people, right? And I'm supplying $2,000 to these 10 peoples, right? So 2,000 divided by 10 means each of these people are entitled to $200, right? But how long will this money actually last these people, right? When we say that there's no end goal, right? We just gotta try and keep these people in home as long as they can, right? When we look at have you guys ever seen the pandemic graph about like the amount of lives lost?
For which one? There's many.
I'm saying like there's just like a very basic graph, right? Where if we allow this disease to last for a continued period of time, right, we minimize the amount of deaths that happen, right? However, if we allow things to continue as they are, a large number of people will die, but the disease will quickly pass by, right, in about half the time. That's basically what the graph says, right? Okay. So if we try and supply these people with money, right, let's say it lasts them a month, right? If we're basing it off this graph, right, we would have to have at least 3 months, right, of money to actually support these people, right? But if we do something like a long period of time like that, right, that is a segment of period of 3 months, the money is going to disappear very quickly in a small number of people, right? So if we take this route with no end goal, right, we're going to be continually funneling money. That's going to be I don't think $2,000 is enough to keep an entire community at home.
Which is why you can help fundraise more.
That I think, is a big pointer for us, at least, who are in North America, is to ask people to fundraise. We are honestly, I mean, I'm not going to speak on US's behalf, but I'm going to speak on Canada's behalf, that there are a lot of very privileged people here, and many of them are looking for ways to help out. They just don't know the means or resources to. So that is where we come into play, trying to connect these people who are here in Canada to the people who need the money back in Bangladesh. That would be kind of like what our job would be. And so that's the fundraising part. The $2,000 would running out very fast. That's very true. It would run out very fast. that's where we have to fundraise. And the other thing that I wanted to sort of address, Sadman, Sadman or Shadman?
Sadman.
Sadman, okay, sorry. Another thing I would like to address is that, based on the graph we were talking about, it's a continuous graph, right? It's not an all or nothing response that you have to reach a threshold and then it'll slow down. If you can even keep them indoors for even a month, that's still gonna slow down the spread versus, having them out in the open, and that's that which is gonna cause the graph to speed up and the infection rate to speed up, right? So that's kind of the approach that I was thinking in my head, that even if they are in there for a week, that's 1 week less patients that gets infected and has to go to the hospital, right? So so the idea is you're spreading out the infections over a longer period of time, rather than all of them getting sick at once at the same time and completely overwhelming the system.
Yeah, so like the term that we've been using in America, we're just saying flatten the curve. So flatten the curve instead of having like a very high maximum point for the curve. If we lower it and spread it out longer, we're not saying that the infection, like the total people who are going to get infected, is going to lessen. The goal is to make sure that the hospital systems are not like drowning with patients that they can't deal with it, and then people are just dying left and right. Because you can manage a certain amount of population that's getting sick, but if you have too many, then you have to go to alternative resources. You just don't know what to do, and that's when things get crazy and you can't like handle it. And I know that Bangladesh is probably going to reach that point very soon, because I think that the most recent a data point that I saw is that there has been 888 total deaths as of today. They've tested almost 400,000 people, but they have like 65,000 positive cases up to today of July 7th, which is a lot of cases, and they're in such a densely packed area. Most of the population isn't in rural areas, and the cases are almost entirely concentrated in either Dhaka, Chittagong, or Sylhet. The bigger cities are what has it. So we have to focus most of our energy in helping quell the spread, particularly if we can help like suppress it in Dhaka. Then that main city, which is like where a lot of people may possibly commute from there to another place in the village, if you can keep it over there, then they would stop spreading it to a rural population that may have even less access to healthcare, And so I don't think, like, if we think about just, there's no end goal at all, like, we don't know when this is going to stop, 2021, 2022. If we think like that, then we do fall into, like, a pit of despair. We're just not going to care, We can't think in a very pessimistic way. What are, like, I feel like, like how you brought up, we have to be optimistic about this, and our hopes are there will be a vaccine or some type of treatment that can be set up so that it's treated easier. But in the meantime, like, we have to focus on helping as many people survive as possible,
So,
Mahia, go.
Okay. I'm so sorry. I was just trying to think about ways I could locally help, like, in Florida and especially. And so far, what I could think of is, I know that the College of Democrats at UCF, to my knowledge, this year we have an Asian caucus. And I could definitely get in contact with them, and we could definitely set something up. If we don't have an Asian caucus, I'll definitely talk to the board on ways we can incorporate your group and your fundraisers into our meetings. And also I'll be working with SouthAsianVolunteer.org, and I can definitely get into contact with them, and we can figure something out. So those are just like two local things we can do.
That's awesome. Thank you, Mahia.
Yeah, of course.
Okay, I am looking at the time. I'm going to give everyone a last kind of speech, what they want to do, and then I'm going to try to wrap it up because it's almost 10 o'clock, 10 p.m. Eastern. Munzir, that feels so weird to say. I've never told you that.
It's okay. You can call me by my other name if you want. That's cool. Sorry, what exactly do you want me to say?
Oh, I thought you had a comment to say, but we're just going to do closing statements.
Okay. Well, yeah. One comment is just a thought that how are we going, that another very big problem that Bangladesh faces is that at the end of the day, even if you have people staying indoors,
Mm-hmm.
there are very densely packed spaces in Bangladesh. There are slums where 6, 5, 10 people are, like, a lot of, not even 10, a lot of people are living in a very short space. So where it's,
Mm-hmm.
even if you're in separate houses, you're still not 6 feet apart,
Yeah.
right? How and what are we going to do for these populations? In what ways can we help? Because from that kind of a population and that kind of a living situation, it seems infection is inevitable. So if infection is inevitable in these populations, what are ways that we can help them? I think that's also something for us to think about.
Yeah, we could definitely bring that up on another conversation. Yeah.
Just going off what Manzir said, or rather what I think is important to like note, right, and the plan that or the direction that we've taken, right, is the thing that I think fearful about, right, is that what is a raindrop in the ocean, right? How much impact can we really do if we focus on a smaller community, right? That's the thing that's really been gnawing at me, right? And I think given time, right, next time we meet, if we do meet, right, per se, I should have a, I think, an alternate plan, right, or an alternate approach that I think that we might be able to take. And for the PR thing, since I'm gonna start doing it, um, I think that tonight, or not really tonight, more so tomorrow, I'm gonna speak to my father about getting in contact with like some Deshi celebrities, right? See what he can do. And I'll try and like ask if he can use any of his reporter friends to actually like spread the word, right? Or whatever word. I'll be more specific next time.
Okay. Thank you, everyone, for joining. It was really lovely to have everyone on. Thank you, Mahia. Thank you, Munzir. Thank you, Sadman. I love the ideas. There's like a lot of things that I just never would have thought of by myself, but that's what you get when you get a collaborative effort. So I'm gonna log off. I'm gonna turn off Facebook Live real quick.